Hello, and welcome to Medical Visits Made Easier. My name is Nicole Callender, and I am a regional director with CAIO. So first, let's just start with who are we and what do we do? At CAIO, we are a team of over 600 professionals in behavioral health. Our team includes behavior analysts, program supervisors, behavior technicians, and our admin team. We provide services we provide ABA services in home, center, and telehealth. We also provide parent training, behavior consultations, and school and community shadow support. We are currently serving major metro areas in over 10 states across the United States, and you can view a full list of our locations that we serve on our website if you go to caiocare.com/locations. So today we will be talking about desensitization, how practice makes perfect, and information to share with the medical professional that you're seeing, as well as choosing a healthcare professional based on your child's needs. And specifically, we'll be talking about doctors and dentists. So first, how and why to use desensitization. Desensitization is a way to make someone feel less sensitive to certain stimuli by overexposure. The individual over time and practice learns to use a new behavior. So we might substitute one behavior, such as taking deep breaths, for an unwanted behavior, such as a tantrum. And you would want to select your replacement behaviors based on what the challenging behaviors are. And then also we would want to shape and reward successful approximations of the replacement behavior or the substitute behavior. So some examples of things that you might, work on desensitization with is COVID-related things like wearing a mask, washing hands, or standing, 6 feet apart from other people. You can also use social stories or visual schedules as tools to help your child. A social story is a story to show a step-by-step version of a scenario that your child might encounter. Visual supports might include a checklist of events that will take place while at the doctor's office, so they can just be, prepared and see exactly what are we going to be doing at the doctor's office and check off each step as they go. So for example, I'm going to the doctor. Here are some things that will probably happen while I'm there. I will go to the front desk so that they know I'm ready for my appointment. I will wait in the waiting room for my turn to see the doctor. And when it is my turn, I will go into the office with a nurse. And this social story also has those visuals so that the child can see exactly what it is that they might be doing. We want to make sure that our story includes who, what, where, when, and how of the specified situation. And then we also want to make sure that we're reading the story really often to our child and not just right before they're about to go to their visit, because that can potentially cause anxiety. Here are some additional examples. So on the left here, we have visuals of a doctor checkup. You see all the things that the doctor might do during their visit. And then on the right, we have, a visual schedule of what this whole process will look like. First, you'll get picked up from school, and then, all the steps of the appointment, and then going to the car. And then of course, something fun at the end, like picking out a candy. Here are two additional examples. One is for going to an eye doctor, and then one is for going to a dentist. Again, each example provides step-by-steps with visual examples. Here we have a visual. Sometimes everyone needs to go to the doctor. It might be because we're hurt or just to make sure that everything is okay. And first we will get in the car to drive to the office. So that might be the first page of your social story book that you have. And then on the right here, we have some visual examples of visiting the dentist. We want to, really work on exposure and starting small. So for example, during a 30-minute dental cleaning, you might start with just 30 seconds and then we take a break. And then you slowly increase that time as the kid, becomes more comfortable. And then you can also use role play or pretend play and modeling to work on, these types of skills that they might be doing at the dentist or at the doctor. So using different toys, a doctor set, checking if their favorite stuffed animal is sick or if mom is sick, brushing teeth together in the mirror, choosing different songs relating to brushing teeth, or even just their favorite songs in general. So we can pair those really fun songs with these activities that we might be doing. Or getting them involved with, picking out the toothpaste or the toothbrush that they might be using. And maybe those those items have their favorite characters on them. So then they're, more excited and it becomes more of a fun experience for them. And again, starting small is really important. We want to make sure that we're not pressuring, we're not pushing too hard, and we want this to be a very fun, pleasant experience for our kids. You can also watch videos, songs, or play apps related to going to the doctor or going to the dentist. Brushing teeth has, over 4 million hits on YouTube. You can check out Choo Choo TV, Sesame Street, Bruno Mars songs, or real life videos. So you can even, have a video of like you brushing your teeth or the kiddo brushing his teeth the last time, and then he gets to watch it again. Depending on the age of the child, there is a video that will hopefully pique their interest. So I just pulled up 3 popular examples we can just look at briefly. We could just watch each one for a few seconds. So first is the brushing teeth song.
Then grab a toothbrush, lead the way. Toothpaste on your brush. Go squeeze. Brush your teeth now. It's a breeze.
Okay, so that's super cute and fun. We also have this example.
Hi, good morning. Good morning. I'm Miss Penny, and these are the Kid Vision kids. And we're here today to find out what happens at a pediatrician's when they do a wellness check.
I'm Jennifer. I'm the receptionist. All you have to do is have a seat and you can sign in.
Okay, so that's more of a real life type of example rather than a cartoon, maybe for some of our older kiddos. And our third example. Okay, there's another fun cartoon, and it included an ambulance. Maybe your kiddo's really interested in ambulances or vehicles or things like that, so that might catch their attention. So just trying to use their preferences and their interests when we're finding materials that might be helpful as tools for them. Also, just some tips: setting timers, using your visual schedule, taking those breaks, using noise eliminating headphones if that's something that would be helpful for your child. Bring your own toys or books or a Brave doll or a Brave toy that can be used. Bring their iPad, bring a blanket, and then also offer special types of treats that they can earn afterwards. So maybe something super special like going to the park or even earning something like ice cream afterwards. So then you can use something called the pre-med principle, which would be first we're going to do the dentist or the doctor visit, and then we get to go to the park. So we want to make sure we prepare and practice. Of course, individualizing the process is super important, just as we talked about, using each child's specific interests and kind of meeting them where they are in regards to, the steps that we're going to take at the doctor's office. Can the kiddo tolerate, 30 seconds, or can they tolerate 2 minutes at a time before they need a break? You may need to practice every step before or group a few steps together. So for example, open mouth, brush a little, rinse and spit, and then take a break. Another example is sit at the table, take a deep breath, practice poking your arm, and then take a break. And you may combine a few different strategies and use whichever combination works for your child. You can also go to the doctor's office before an appointment to become familiar with the waiting room, or even show pictures of the waiting room or the doctor ahead of time just to prepare your child. And then also it's important to be aware of your own body language. So children are very receptive and look to see how their parents are acting. Additional tips might be, while you're at the visit, take pictures to make for the next time, make a little story for the next time that you go. And then just ask even there, what toys do they have available? Which nurses and doctors and other people are in the office, and see if you can add all of these items to your social story to prepare for your next visit and make it a little bit easier. So, during the time of COVID, there may be new community rules or rules at your doctor's office. So you would want to make sure that you discuss the new rules and expectations, explain why they're important or why they are required. Check for understanding. So can you show me how you wash your hands? Practice wearing a mask, before you're actually at the doctor's office, because if the doctor's office requires a mask and, it's the first time kiddos put a mask on in a while, can be really overwhelming. So just adding that to your pretend play at home, just practicing and desensitizing them to the mask before you're at the appointment. And then using a lot of specific praise. So, I love how you're doing XYZ. You also would want to make sure that you're sharing information with your doctor or your dentist. So before your visit, you would want to inform your medical professional or the medical office of your child's disability or their specific needs. Explain your child's strengths and challenges. Let the office and the doctor know that your child may be more sensitive to the visit than others. And then also give the doctor tips on how to best engage with your child, how to implement ABA strategies, what type of tone of voice to use. Some kids like really fun, upbeat, energetic types of tones, and then some prefer more calm, reserved, softer tones. So just, whatever your specific child prefers, just giving your doctor a heads up too, so they can be prepared. Also, just being aware of things like, is your child sensitive to loud noises, to too many people in the room? Make sure to inform your doctor of these things ahead of time. And you may also have to compromise the duration of the visit to have a shorter, more successful trip and increase the likelihood of your child being more willing to return in the future. So kind of just being like, okay, today we had a 5-minute visit. That was awesome. Maybe next time it'll be a little longer. It's better than trying to push too long of a visit and then having, the kiddo have a bad experience, and then they're not going to be as likely to want to participate in that activity again in the future. At the visit, remind the doctor of your child's likes and dislikes and ask if they would kindly greet your child in the lobby or the reception area. Inform your child of each step in advance. Make environmental modifications like dimming the lights or limiting the amount of people. And then using specific positive language like good job lying down, or even using countdowns or timers to let the kid know, like, when will they have a break? When will we be done with this portion of the visit? It's also important to choose a healthcare professional that might have experience, working with children that have specific needs. So you want to look for pediatric dentists in your area who have experience serving children with special needs. You can check out my autism team. They have a directory for dentists, doctors, and other healthcare providers, and you can search based on distance, most recommendations, and their rating. Also, one of the greatest helps might be, reaching out to your local community. So if you can join like a Facebook group or something like that, and see, what are pros and cons to, different providers, and just see what's the community recommending as well. Also on my autism team, you can filter. So you can show, list in alphabetical order, or most recommended, or based on distance. And this is just an example of what the My Autism Team website looks like. So again, you just type in what type of provider you're looking for, and then you can search by city. And then filter by best match, most recommendations, alphabetical order, most teams, and then also by distance. So you can also check out Autism Research Institute, or ARI. They have a comprehensive list of clinicians, and then they also use a database approach to find clinicians. And the website has tips to use and questions to ask a potential provider to even further prepare ahead of time. And again, like we talked about, reaching out to your local community resources. Then you can hear personal stories from people as well about their experiences. Okay, so now we can open up for any questions. Some frequently asked questions are, what are some other strategies that you can use? So I always recommend, really focusing on proactive types of strategies. So, offering the child choices, like, do you want to go into your appointment in 1 minute or in 2 minutes? Do you, want to bring your puppy stuffed animal or your cat stuffed animal? And then, just really also kind of following the child's lead and seeing, like, does it look like they might need another minute before we head in, or are they ready to go now? And then again, offering reinforcers can be really, really helpful. So, do you want to bring stickers or bubbles, or, playing the child's favorite song during the visit? Whatever that child might be interested in, that can be really helpful as well. So identifying some type of reinforcer that we can provide to them after they have their visit with their doctor. Okay, let's see. So I just want to share that you can schedule an ABA therapy enrollment appointment at kiocare.com/enroll. You can also reach out to our client services department at clientservices@kiocare.com, or you can call our main line, which is 877-264-6747. All right, thank you all for joining today. And please don't hesitate to reach out if you do have any follow-up questions that come up. Have a great day. Bye.